Good afternoon. My name is Dr. Bikash Majumdar. I'm one of the senior consultant interventional cardiologists. Today I'm going to talk about the symptom recognition of heart diseases. As you are all aware, that heart disease has become a huge problem in our country. Nearly 3 million people suffers from heart attack in our country every year. So it is very important that we recognize the symptoms early so that we can take proper measure and diagnose these conditions earlier so that people do not suffer from heart attack at the end. So how do we know that someone is suffering from heart diseases? There are certain symptoms that we all need to be aware of. Many times we ignore these symptoms because we don't know about them. So one of the first symptoms that people can get is exertional chest discomfort. That means whenever someone is trying to exert himself, trying to walk a distance with a little bit of pace or trying to climb up the stairs, he's getting central chest discomfort. I'm showing you, it's getting some discomfort on your chest, in the middle of the chest, which may be radiating towards the left arm, the inner side of the left arm. It can go up to the jaw, and it can also go in between the shoulder blade in the back or near the neck. And whenever you stop, then these symptoms goes away. So if someone is getting this kind of symptom, this is an alarming symptom, and this could be the symptom of the heart artery blockage. So one should be aware of this kind of symptoms. Second type of symptoms that patient may actually encounter is exertional shortness of breath. That means normally you are fine, but whenever you are trying to climb upstairs, you are feeling breathless, or whenever you are trying to catch a bus and rushing, you are feeling breathless than usual, then that should actually raise an alarm that whether you are having any problem with your heart or not. If you're having this kind of symptoms, it is better to go and consult your doctor so that your symptoms can be recognized, the tests can be ordered, and your conditions can be diagnosed early, and the corrective measures can be taken so that a fatal heart attack can be avoided. Third symptom is transient loss of consciousness. So someone, particularly if someone is elderly, say about 65 to 70 years of age, or say maybe 75, suddenly transiently loses consciousness for a few seconds and again comes back to normal. It just happened only for a few seconds. Many a time we ignore this kind of symptoms, but one should not ignore this kind of symptoms because this could be related to your heart. This could be related to your heart rhythm problem. Sometimes the heart rate can go too slow and someone can become unconscious transiently for a few seconds, and again after a few seconds he will be absolutely fine. This kind of episodes can happen once in few months or once or twice in a year. So nothing to ignore about this kind of symptoms. So this is another symptom that we should be aware of, and if this kind of symptoms happens, then he should definitely see his doctor or a cardiologist, and investigations can be ordered and the condition should be diagnosed. So the next kind of symptoms that one should be aware of is kind of palpitation. Now many a time, most of the time we are not aware of our heartbeat, though our heart is constantly beating, starting from the mother's womb to the last day of our life. But we are not aware that heart is beating. But there are some times that you can be aware of your heart racing or beating in an irregular fashion. That can be very uncomfortable, that you are aware of your heartbeat. So if you are feeling this kind of symptoms, you also need to go to your doctor to see whether you have any significant heart rhythm problem or not, and that can be diagnosed with few tests like ECG, or doctor can also request an echocardiography or a 24-hour Holter, something like that. And fourth kind of symptoms, sometimes that you should be aware of, is shortness of breath or chest discomfort at rest. If someone is getting shortness of breath at rest and chest discomfort at rest, then that is an alarming symptom. So you should seek advice from your doctor immediately, particularly, so for example, if someone lying flat at night and had to wake up in the middle of the night because of breathlessness, that could be a sign of serious heart problem, particularly heart valve problem, or particularly if the heart is not pumping well enough, they actually can cause shortness of breath in the middle of the night because there may be accumulation of the fluid in the lung and you wake up with shortness of breath in the middle of the night. So if you are getting this kind of symptoms, it is better to seek doctor's advice as soon as possible. Now, one other thing that I would like to emphasize here, that there are certain emergencies where you can't actually wait, and better to present yourself to any of the hospital emergencies rather than in the clinic. So if someone gets chest pain at rest, in the central chest pain as I said before, and you are doing nothing, sitting or just lying, but you are getting pain in the middle of the chest which is lasting more than 10 minutes and going to your jaw, to the left arm or in between the shoulder blades, and it's not getting relieved even after taking a sorbitol tablet under the tongue, then that is the time it could be a symptom of a heart attack, and at that time you should be going to a hospital emergency so that you can be treated urgently. So these are the few symptoms and signs that you should be aware of, and you should take precautionary measures, and you should seek advice from your doctor or your cardiologist so that your condition, heart condition, can be diagnosed early and it can be treated early, so that the fatal heart attack incidents or any problem with your heart does not happen. I hope you stay well, take care of your high blood pressure, take your medications properly as prescribed by your doctor, control your cholesterol, and if to control your cholesterol you need to take some tablets, please continue to do so. You need to control your blood sugar if you are diabetic, and stick to advice of your doctor, and continue your anti-diabetic tablets. Try to do regular exercise, at least half an hour exercise every day. That will keep your heart healthy. Even if you are a heart patient and you are under a doctor, please don't stop your regular exercise. So whatever you can do, if you can walk a little bit, that also helps. So more active you are, the better is your heart, and I hope you stay well and stay healthy.